Hi there, welcome to a presentation by CBH Education on our pharmacy revision series. Today we're going to be focusing on asthma case studies and some of the key themes that come up with asthma, the types of cases presented in OSCEs, the type of cases presented in practice, and where you can support patients as well. Now, asthma is restriction of the airways. Patients start with salbutamol. You have to consider the type of asthma. So is this exercise induced? Is this seasonal asthma? Is this occupational asthma? Is it childhood asthma? Are they diagnosed with asthma as well? You have to identify patients dependent on their blue inhaler. And obviously are they on a preventer, and are they using this long term as well? And obviously their inhaler technique is important as well. Let's consider case number one as a pharmacist prescriber. Patient JF is somebody who uses their blue inhaler regularly 3 times per day and are requiring this more often. They have exercise-induced asthma. They have been feeling more breathless. They only use the blue inhaler. They're 49 years old, smoker for 20 years, alcohol 6 units per week, take no other medication, no other symptoms, recent A&E admission, rule out cardiovascular disorders. So here is some of the key information that you've got. 3 times per day exercise-induced asthma, that's already going to put a cause for concern as well. So you're going to think, have they had a preventer before? Have they tried a preventer before as well? Smoker for 20 years, right. So have they reduced? Have they increased? Are they stopping their smoking? What is their smoking pattern like as well? And then obviously you give their healthy living advice as well. Alcohol 6 units per week. How often do they drink? Do they drink more than the 6 units per week? Is it more social occasions? So it's really harnessing that information as well. And how are you going to do this, and how are you going to approach this situation as well? So there's a few things that you can do here. So you initiate the patient on a steroid inhaler. Clenil starts at 50 microgram twice per day, and then you review the patient in 2 weeks. If the patient is still breathless, then you can refer to 2-3 weeks for a review appointment. You will see the patient as well in looking at their progress, and are they identifying any problems as well? Are they presenting with anything else? Are there more symptoms? Has the preventer worked for them as well? And if you're an advanced practice, then you can consider a chest X-ray potentially, but that's something you need to discuss with your clinical supervisor. Symptoms like a cough need to be reviewed. Now, what will happen is patients may present with a cough for 3 weeks. It may be treated with antibiotics, and then obviously it may not have resolved. It may be that they've had a viral infection. A cough obviously longer than 3 weeks does need to be looked into as well. So what may happen here is you may need to link your symptom knowledge from community into practice to integrate and establish what's going on here as well. And another thing as well here is observing patients with their inhaler technique, and do they require a spacer device as well? Okay, so the next case is patient JT is prescribed Foster, and then we stepped up from Clenil. Although they are finding symptoms are being relieved, they are still complaining of breathlessness. Your patient JT has 69 and has angina, recent myocardial infarction, previous hypertension. They take the following medication: aspirin, clopidogrel with 6 months left, bisoprolol, ramipril, lansoprazole, GTN, Foster, and salbutamol easy breathe. Recent cardiac investigations identify no heart failure. What therapy would you add in, and are there any potential drug interactions? So you've got quite a line here of what really goes on with patients' therapy. So when patients do have a heart condition, they may inadvertently have a respiratory condition as well, and this crossover is about 30%. So how would you manage this kind of case study? So what's really key here is making sure that patients are managed in the of course with the guidance, but also making sure that you're supporting them as well. Although medications are initiated, the other bit is making sure that are they using their inhaler properly as well. Are there any issues that they've got with their lifestyle management as well? Because in these kind of reviews, you can actually get to grips with both the clinical aspect and the social aspect as well. And there's been really good interventions that pharmacists have made to support patients as well. You also, in this case study as well, the patient did not smoke and they only drank 3 units of alcohol per week. So what was the solution to this case study? So basically, the interaction is you consider the use of salbutamol and bisoprolol. This was reviewed obviously by specialist and this was okay. Now, Montelukast was added in here and this was worked in. It was reviewed in 2 to 3 weeks. Also, what was done as well, patient was given a spacer device, which is another thing to help them with their technique. And then after the 2 week review, they were found that they had less breathlessness, and then Montelukast was added onto their repeat prescription. So, cases in pharmacy practice. So, when you're working in a GP surgery or you're working in a hybrid role doing respiratory clinics as well, you've got to make sure that patients are ordering their preventers at the right time and they're not ordering more salbutamol than the preventer. Because what tends to happen is patients will overorder the salbutamol, they become dependent on it, and then they will not use the preventer. And then there's still this misconception that salbutamol is the go-to inhaler for preventing the respiratory symptoms. And you'll find that this is ingrained in a lot of patients, but it's one of the key things is educating patients and using the resources that you've got effectively. If patients are non-compliant with certain inhalers, you've got different devices. You've got the MDI device, you've got the DPI device as well. So obviously that's another aspect that you can look at there. And also coordination with the inhaler technique as well. And when you're doing your asthma reviews, using something like the ACT scoring. So if that score is under 20, it's about reharnessing their thinking, what their understanding is, and educating. Look, this is how you manage things in accordance with the guidance, and even promoting that using resources like asthma.co.uk as well. Promoting healthy lifestyles is another thing that you can do. Diet, exercise, and also smoking cessation as well, referring them to the community services to help patients reduce, issuing the steroid card as well, supporting with the flu jab and COVID jab, because obviously if patients are taking steroid medication, it's a form of immunosuppressant, so it's really key that patients do get obviously the flu jab and COVID jab, so they are protected. And then obviously if a patient has heart condition and it's worse and then they're feeling breathless and you've done the respiratory side of it as well, it's worth talking to your clinical supervisor about doing a pro BNP if you are training and looking to be a more advanced practitioner and a more advanced practitioner role as well. Now, pharmacists are really playing a key role in working with respiratory nurses as well and community respiratory teams in supporting patients with therapy, in supporting patients with goals of therapy as well, and also optimization of inhalers as well. As discussed, you've got the MDI inhalers and the DPI inhalers as well. And one of the key things is really making sure that you're supporting that patient with the technique. So when they present in the pharmacy and they're saying, look, they're feeling more breathless, examine the inhaler technique, refer back to the GP as well. There are plenty of things now and tools that are there to support patients, because obviously if you optimize the medication and things work for the patients as well, you're showing that obviously, number one, you understand the condition, and number two, that you're there to support the patients as well. Thank you very much for listening to this presentation on asthma by CBH Education. Further presentations on pharmacology, OSCEs, pharmacy revision, OTC revision, the legal aspects of prescribing, please follow us on our Facebook, Instagram and YouTube channels.